Thanks, Darcy. Me personally, working in the OR, this is an interesting question. I like to think the air is pretty clean. Thoughts on that?
So it is true that the virus can be spread through the air. Now, for a patient to be able to shed enough virus in the air to be a high risk, the patient has to be very sick, has to have a lot of cough and respiratory symptoms. Now, hospitals have special rooms that we use to isolate those patients. They're called negative pressure rooms. So what happens there is you put the patient in that room and the air is kind of sucked out through a special filter and doesn't circulate within the hospital. So in those cases that the patient has an infection of this type, or there's a risk of transmission through the air, there's a special systems in place in the hospital to try to deal with that. That happens with other infections like tuberculosis and things like that. So we have systems in place to address that.
Well, this is a great segue for people who do live in the area. You guys both are at two big hospitals here in Columbia. Are those conversations, I'm sure, has been going on for weeks? Is there anything specifically that you guys have going on for these patients, potential patients?
Yeah, so all the hospitals have been preparing since this first came to light around December 2019. And at Prisma Health, where I work, there has been preparation in the emergency department to make sure that if a patient is referred to the emergency department, there is awareness of the incubation period, the symptoms. They are placed in a room where a healthcare provider enters after gowning, masking, wearing goggles, because during previous epidemics, almost 40 to 50% of infections happen to healthcare providers, respiratory therapists, people who come into direct contact with secretions. So I think, and we also don't want to spread it to other patients. So outpatient facilities as well as hospitals are prepared. They are working under the direction of the health department, who is getting direction from the CDC. So there is a lot of work going on in the background. And I think to be more informed, since you are sending all these questions in, you should also log into the health department website. As I've said earlier, they talk about what to do in schools, colleges, hospitals, and there's a lot of information out there for all of us to look at. It's better than misinformation. It's good, validated, evidence-based information as best as possible.
I also noticed there's a lot of travel questions coming in. People, what are your thoughts around this? Not to travel, to travel? I know it's hard to say.
So, I mean, there's places where you probably don't want to travel because the epidemic is in full outbreak conditions there. So obviously China and, Iran and some places. Now, the truth is, like the question about, should my child go to London to travel? I mean, it depends, because by the time, summer comes, or by the time you need to make that travel, the situation may have changed. So it's hard to make, hard recommendations about that. I would definitely advise not to travel to places where there's an ongoing epidemic and a lot of new cases. But, traveling within the States or traveling with, to countries where there's not an outbreak, I think is still fine.
And just to sort of piggyback on that, for example, the Tokyo Olympics, which are scheduled for this summer, they are thinking about it. The planners haven't decided on whether to go ahead with it. They are taking it week by week. And the same thing applies to Japan. Japan apparently has shut all schools down for a month. So there is a lot going on that is developing all the time, and we don't know which way this will go. But preparedness and awareness is the best thing, and prevention. And we'll find out more in the days and weeks to come how this is going to evolve.
Great. Thanks so much, doctors. And we'll be back again with more of your questions after the break.